Introducing the latest advancement from BD in bone marrow biopsy technology, the BD Trek Powered Bone Biopsy System. The BD Trek Powered Bone Biopsy System is comprised of a variable speed power driver and the BD Trek Bone Marrow Biopsy Kit. The power driver is a handheld, battery-operated, reusable bone drill with a variable speed function that's trigger-controlled for low, intermediate, and high-speed drilling, and an LED indicator that displays driver's speed and battery level. The LED brightness indicates the relative speed of the power driver. Full brightness indicates that the driver is operating at maximum speed. When the power driver battery becomes low, the LED color will switch from green to amber, indicating when it's time to order a new driver. To perform a bone marrow biopsy, the reusable power driver is paired with the sterile, single-use BD Trek Bone Marrow Biopsy Kit, comprised of the complete array of accessories you see here. Needle kits are available in multiple sizes to meet your clinical needs. To begin a procedure, remove the needle components from the package using aseptic technique. Inspect each needle for any issues that might impair proper function, and remove the protective needle sheaths. Next, insert the power driver into the sterile sleeve until you hear an audible click. The sterile sleeve features a zip closure and adhesive strip for secure and easy setup. Pull up the sides of the sleeve and seal the sleeve with the zipper. Peel the paper backing from the adhesive strip and fold the flap onto the sterile sleeve. The Quick Connect hub allows for easy needle connection and disconnection. Simply push the release arm forward with your thumb. The release arm can be rotated for left-handed or right-handed use. Make sure the needle assembly can be connected and disconnected without difficulty from the Quick Connect hub. At any point during a procedure, the optional manual driver can be used. Next, prepare the biopsy site using aseptic technique and puncture the skin with a scalpel. Insert the needle assembly through the skin incision and lightly squeeze the trigger to slowly advance the needle into the medullary space. The brightness of the LED indicator will display the relative speed at which the needle is rotating. To disconnect the power driver, push the release arm forward and pull the driver away from the needle hub. Remove the stylet by turning the stylet hub counterclockwise and remove, leaving the cannula in place. To capture an aspirate sample, connect a syringe to the cannula hub. Then collect the aspirate, disconnect the syringe, and remove the aspirated specimen. For a core biopsy, reattach the power driver to the biopsy cannula, squeezing the trigger to advance the needle to the desired depth to capture a sample. To remove the needle with the sample, pull up on the power driver with the trigger still engaged until the biopsy cannula is completely free of the patient. Then detach the biopsy cannula from the power driver. To eject the biopsy sample, insert the cannula tip into the ejector guide. Then insert the ejector rod through the biopsy cannula tip. The sample will be ejected from the biopsy cannula hub. When the procedure is complete, remove the power driver from the sterile sleeve by grasping the raised edge at the rear of the Quick Connect hub and pulling it off of the power driver. The BD Trek Powered Bone Biopsy System, the latest advancement from BD for bone biopsies.